The first thing that I got involved with when I came to Kelowna, which is 22 years ago now, was the coach program. And so that was a program that was spearheaded to try and really get some cardiac rehabilitation for patients who already had cardiac events, and also to look at some prevention and preventative medicine for those patients who had high risk.
Cam makes a big difference at our clinic. It's amazing. He's really represents patient care at the highest level, and he's very down to earth and very knowledgeable. He provides information about medication compliance in a way that people adhere to, and they felt like they made the decision to do that.
I think that program has really taken a role in the community that was greatly needed, and so that's a really passionate area for me.
Our pharmacy does all of the medications, the contract for BC transplant, and so on a weekly basis we send Cam to the hospital to work with the team there who assess the transplant recipients on a regular basis, and they get to see, when they go there, they see the nurses, the dietitians, the physicians, and they get to see Cam.
The main thing is getting somebody who's got these sort of skills out to where they can do the best work, and you have to give them access to patients. And so him going to the hospital and working with a team environment there, it's important for the patients to have that level of access to someone with the knowledge.
My other role with the transplant clinic is actually directly in the hospital. So seeing patients as an outpatient clinic there for renal transplant patients and having some direct impact in patient care at that site really complements the patient care, because it shows them some continuity between what they see and what they experience in the hospital, and then they come and have the same pharmacist and the same information in the community as well. So it does that, it gives the patients a lot more confidence in their care, I think, as well. I've been involved with the OAT training course as well, and that's a really important area for collaboration as well, because that patient group and the prescribers in that group do rely on the pharmacy for support and for more information back to patients and back to prescribers about how people's health care is progressing.
Cam represents a human being that doesn't mind going the extra mile outside of his 9 to 5, so we really, really appreciate him.
It's really nice to see him recognized for what he does in the community and for BC Transplant and the Renal Agency, and it's phenomenal.